being overweight is a risk factor for high blood pressure. What can we do on our part to reduce our risk of having high blood pressure? In our previous video, if you haven't watched it, please don't forget to watch it. We talked about how to predict your 10-year risk of having a heart attack or stroke and potentially dying. We mentioned some of the risk, and one of them is high blood pressure. So today we want to discuss what can we do to reduce the blood pressure that we have. The first one is to have lifestyle modifications or do some lifestyle changes, the simple things that we know how to do best. Before the doctor or the pharmacist gives you medication, the first thing you should do is to see if you can change your lifestyle. And we said being overweight is a risk factor for high blood pressure. So then if you're overweight and you have high blood pressure, the first way to go is to reduce your weight. Try and lose some weight. And it is actually documented. It's the documented fact that every 10 pounds weight loss leads to, I think it's about 5 points in blood pressure reduction. It's the fact there that if you reduce your weight, you reduce your blood pressure. So that is one thing that we can do on our part as something we have control over. Along with the weight loss, we can increase our exercise and physical activity. Not being stagnant and staying in one place will help us also to improve upon our blood pressure. Also, we have to change our diet. According to the JNC, again, recommendations for diet also include eating greens, eating green vegetables, your salads, your greens, basically however green it is that you eat. Those will help in reducing your blood pressure. Also, increasing your fiber intake will also help, and also cutting down on carbohydrates will also help. Cutting down on the sugars and your carbs will also help, as well as eating less fat. Less fatty meals will also help. So those are simple lifestyle changes that you could do to reduce your blood pressure. And definitely cutting back on salt and sodium intake will also help. Being a little more vigilant, looking at the labels when you're buying food or buying stuff on the shelf, making sure that the sodium contents are not high there. If you have two products costing about the same, or even one costing more, your choice should be the one that has the least amount of sodium, with the idea being that you're protecting yourself from having high blood pressure or improving upon your current situation. We also have another control over our sleep. We can sleep more to improve upon our blood pressure. Sleeping more. If you have problems with sleep due to sleep apnea, you need to see your doctor to have help treating the sleep apnea, because once that is resolved, it will tremendously affect your blood pressure. But you don't have sleep apnea, but you don't have consistent sleep. We need to also check on that. And the other thing is to reduce stress. If you haven't watched my videos on reducing stress, make sure you go on there and look at some of the videos on how to reduce stress. I have several videos out there. Reduce stress and anxiety. All those will contribute to reducing your blood pressure. And definitely cutting down on alcohol. That will also help you to reduce your blood pressure. Cutting down on alcohol or stopping alcohol altogether will also help you reduce your blood pressure. Knowing that alcohol does not only affect your blood pressure, it also affects your liver. Most people who drink over a long period also have a disease called liver cirrhosis. So if you are if you are drinking alcohol all the time, you have 2 reasons to stop. All right. And then lastly, to control your blood pressure, you may need conventional medications. After all the lifestyle modifications are done, sometimes because of age and because of how high it is from the start, it is not impossible to reduce it to the normal, especially when you look at where normal is at this point. 120, less than 120 over less than 80. It is almost impossible for a lot of people to achieve this just by lifestyle changes. And for that matter, if you work with your provider or your medical doctor, there may be the need to add onto it some medications, and not just getting the medications but taking them consistently. One thing that I've noticed is that people stop taking medications because they feel they have side effects with one, but you will not believe how many medications are out there for one particular issue. So if one medication doesn't work for you, or you have a problem with one, it is not a reason to say that I'm not taking medications, because there are countless others that work for the same reason that you're taking the first one. So you just have to work with your provider or your pharmacist, and they can be switched for you so that you can continue to be on the medications for your blood pressure to be reduced. And then consistency on all those things we have discussed will also help you improve upon your blood pressure. So I thank you for watching this. If you didn't see our last video about your risk, predicting your 10-year risk of having a heart attack or stroke, don't forget to check on this side, or that side for that matter, wherever it is. But don't forget to watch that video and see how you, or where you stand in the next 10 years, whether you're going to have a heart attack or whether you're going to have a stroke, or whether you're going to die within the next 10 years. Thanks for watching. Hope this will help out. And beloved, we wish above all things that you prosper and be in health, even as your soul prospers. Thank you.